put it in the comment section. We would like to know so we can also reach out to you. Appreciate you being on. And all of our regular followers, would you go ahead and share with others because we have a very important lesson tonight. Just want to kind of introduce you first to the lesson. Lesson is going to be on diabetes. It is a major problem among African Americans. We were planning a diabetes workshop this summer, but because of the COVID, things didn't go that way. We had to change, but thanks be to God, to the media, we're still able to do some of those things. And also there were several people who were very instrumental and wanted to have this. The media people already got your name, and we're going to make sure that you're at least on. Diabetes is not a new thing. I can remember when I was a child, my mom would go next door every morning, give the neighbor a shot. So some of this may not be new to you, but something that is serious. And I believe we need to have reminders and wake-up calls, as we've done with other these type workshops. This is not a diagnose section. It's not a treatment section, but it is information and warning, and to be able to, reach out and find some more help and to remind us about the dangers of these things. I'm just glad tonight to have with us Ms. Rhonda Norwood. She is a PharmD CDE BCPS, and I was introduced to her by our own Keisha Bryant. Appreciate you, Keisha. She's obtained a Doctor of Pharmacy degree from Florida A&M University. We are so familiar with our HBU. She's currently working at the VA outpatient clinic in Delray Beach, where she primarily provides diabetes, HTN, which is hypertension, cholesterol and anticoagulation management. She got all of those different skills and ability, and we're so happy to have her. She's also an active member of St. John Missionary Baptist Church in Boynton Beach. She's the mother of two beautiful girls and the wife of a general contractor. If you have questions tonight, go ahead and ask them, but we will save them and answer them at the end. So please write them down. Don't be forgetful like me. I'm gonna write mine as we go through because I got a lot of questions. So please write your questions and be ready. I present to you tonight, Ms. Rhonda Norwood. Thank you so much, Rhonda, for accepting this challenge.
Thank you, Pastor, for inviting me to speak to you all. I am going to share. Okay, so as Pastor said, I am going to be talking to you all about diabetes mellitus. There are multiple types now of diabetes, but for tonight's presentation, we're just going to solely focus on type 2 diabetes. Things that I'd like to accomplish by the time this presentation is over is hopefully everyone can define diabetes and have a better understanding of what it is. I want to discuss the disparities amongst minorities, specifically African Americans. I'd like to discuss the goals of therapy and the treatment goals so that when you go to your doctor's appointments, you know what they're targeting or what the ultimate goal is for your treatment plan, as well as review the different types of treatment. And then finally, we'll discuss the complications of diabetes and ways to avoid them. Especially in these times that we're in right now, we want to make sure that we have a healthy mind, body, and spirit. I understand that you all went through a series on mental health and it was fed for the mind, and then you get your spiritual feedings. So tonight we're going to focus on feeding the body and making sure that you have a healthy body as well so we could do the work of God. When putting this presentation together, I came across 1 Corinthians 6, 19 through 20 that says, do you not know that your bodies are temples of, Do you not know that your bodies are temples of the Holy Spirit who is in you, whom you have received from God? You are not your own. You are bought at a price. Therefore, honor God with your bodies. So we have to make sure that we're taking care of our bodies. In Ephesians 2:10 says, "For we are God's handiwork, created in Jesus Christ to do God's work, which God prepared in advance for us to do." If our mind, body, and spirit aren't healthy, then we can't do God's work. So what is diabetes mellitus? Diabetes has two main causes. We have an organ in our body called the pancreas, and the pancreas produces a hormone called insulin. And if your body is either not producing, or the pancreas is not producing enough insulin, or there's a barrier to our bodies being able to use that insulin, the end result would be diabetes. Now, either your pancreas isn't producing enough insulin, which could be a genetic cause, or there's a barrier to the insulin that you are producing, which is usually abdominal obesity. So if we have a fat layer in our stomach, that is more than what it's supposed to be. So we have more fat in our stomach than we're supposed to be. The body can't use the insulin as it needs to, and then we develop diabetes. Insulin's primary job is to go through the bloodstream, pick up all the extra glucose or sugar. Glucose is just a fancy word for sugar. So it's supposed to pick up all the excess sugar throughout the body and take it back to the cells where we use it for energy. So if we don't have enough insulin, or our body doesn't recognize the insulin, then that sugar builds up in our bloodstream. And that's how you get a high sugar level. And that in turn then leads to other complications that we'll discuss. This slide is very scientific, but I like to include it because it shows the natural progression of diabetes. So basically, it's saying, in simplistic terms, as time goes on, insulin resistance, meaning that our body isn't recognizing, it's resisting the insulin that we produce. So insulin resistance increases. And as a result of that, this blue line, glucose levels increase, and insulin production goes down. So over time, if we wait too long to treat diabetes, it is harder to control because diabetes is a progressive disease. So if you catch it earlier, when you're first diagnosed or when it's first developing, it's easier to control. The more time that passes, it becomes harder to control. There are many disparities when it comes to diabetes, especially amongst African Americans. I only listed a few here, but it disproportionately affects our population. We are 77% more likely to be diagnosed with diabetes when compared to white Americans or Caucasians. We have a lower quality of care. Research has shown that we are not offered the same medications. We're not offered the newer cutting edge medications because there's an assumption that we can't pay for them or can't afford them. There's insurance issues when it comes to minorities, as well as there's a lack of access to care. Specialists aren't, setting up their practices in our communities. So we don't oftentimes have access to an endocrinologist or a certified diabetes educator, or a primary care specialist or a primary care provider that specializes in diabetes. So there's often a lack of access to care as well. So the goals of therapy that are set by the ADA, which is the American Diabetes Association, are listed here. First and foremost, I want everybody to understand that goals are always individualized. They give us treatment guidelines, but you have to take everybody's individual situation into consideration when establishing their goals. So these are just in general terms. They recommend that the fasting glucose, which is your fasting sugar when you first wake up in the morning before you've had anything to eat or drink, your sugar should be between 80 and 130. And this is for a diabetic. This is not for somebody who's not been diagnosed with diabetes. So for a diabetic, your fasting blood glucose or sugar should be between 80 and 130. Now, 2 hours after you eat a meal, the goal is to have the sugar less than 180. Now, the A1C is what we primarily use to determine how controlled or uncontrolled your diabetes is. And that is the 3 month average of your blood sugar. And it's reported in terms of a percent. So the general population, the goal for the A1C, if you have diabetes, is less than 7%. People who are much younger, who don't have any other medical conditions, we may try and push and be a little more aggressive and target an A1C of less than 6.5%. And then for older individuals or for those who have multiple medical conditions or may not be able to tolerate a lower blood sugar because of hypoglycemia, then we target less than 8%. And I have some patients that I manage that I even target less than 9% because historically they've been as high as 14 and 15%. And our goal is to really just get them under 10. We don't have unrealistic dreams that we're going to get them all the way down to 7%. So we have to be realistic. We have to take the whole person into consideration, look at their other medical conditions, and then you and your doctor together come up with what your goals should be. A lot of people often ask, what does the A1C mean? I know you're giving me a percent, but what does that percentage mean to me? So I put here a list of the correlations of the A1C to the average glucose. So if you have an A1C at 7 and you check your blood sugar at home, the reading average that you're probably getting at home is about 154. If you have an A1C, your doctor tells you your A1C is 10%. That means on average, your home blood glucose readings when you prick your finger is probably 240. So this slide is just to give you an idea in terms of when the provider tells you what your A1C percentage is, what that correlates to in the numbers that you would see at home. So whenever we treat diabetes, this usually comes along with hypertension, high blood pressure, as well as dyslipidemia or uncontrolled cholesterol. So whoever is treating you, you want them to treat the whole picture. So make sure that not only is your diabetes being treated well, but that your blood pressure is under control and your cholesterol is under control. These three things come together. So it does us no good if I get your diabetes under perfect control, but your blood pressure and your cholesterol are still high. So you want to make sure that all three things are being managed properly. The treatment goals that your provider should be targeting for you is to primarily obtain better glycemic control, which is better sugar control. You want to make sure you're avoiding the two ends of the spectrum, hypoglycemia, which is a very low blood sugar, as well as hyperglycemia, which is very high blood sugar. So you don't want to go too low because that comes with its own complications. And then you don't want to be very high, obviously, because you're the long-term complications that comes with that. So we want to make sure that we're getting better control and keeping you within those parameters that we previously discussed. And then ultimately, we want to reduce and prevent the complications and improve the quality of life. And although I'm a pharmacist, I have the opportunity to do things like this and educate patients about diabetes because I'm also a certified diabetes educator, which were the CDE letters behind my name. So I'm not going to spend a lot of time talking about the individual medications. I'm just going to give you an idea of what's available. And then if anybody has any specific questions, I put my email address at the end of this presentation, or you can put, if you're comfortable, any questions in the chat group. But again, I'm not going to go into individual drug treatment regimens. And medical nutrition therapy, that just is a fancy way of saying diet and lifestyle changes. So that is the primary way to treat diabetes. We want to do this in addition to any medication that we provide. So the first step is medical nutrition therapy. And again, I'm a pharmacist. I'm not a nutritionist or a dietitian, but I will give you some helpful tips that you could follow. And then I'll review the oral medications, the injectables, which are very new for us, and then some different and newer insulins as well. When it comes to diabetes and food choices, the general concept to keep in mind is to try to avoid white, simple carbohydrates and try to incorporate more whole grains. And you also want to avoid high sugary foods, desserts, and drinks. So I put here on the left of the screen some common choices that we may be currently eating, and then what the healthier alternative may be. So, most of us have a diet that might consist of white rice. So, the healthier alternative, especially if you have diabetes, but helpful if you don't have diabetes, would be brown rice. Spaghetti, instead of spaghetti, regular spaghetti noodles, you want to substitute and use whole wheat pasta. And then, in place of mashed potatoes, a great alternative is a sweet potato. Of course, instead of fried foods, especially if you also have high cholesterol, you would want to bake your foods instead. And then, as an alternative to dessert after dinner, you may want to enjoy fruit. And when it comes to fruit, those also have a lot of natural sugars in them. So we have to be careful and mindful of how much we're consuming and what types of fruit we're consuming. Um, just as a general note, things that are very sweet to taste usually have more natural sugars in them. So bananas, oranges, grapes, mangoes, those have a lot of sugar in them. So you would want to minimize those and try to incorporate more berries. So like strawberries, blackberries, blueberries, raspberries, those are a better alternative. And you can do melons as well. So instead of dessert, maybe trying to incorporate some of those fruit. And then lastly, here I have, instead of chips, maybe you could substitute with nuts. And again, taking cholesterol into consideration when you're eating nuts, you would want to keep that to a handful or a fistful because peanuts and certain nuts can raise the cholesterol. This portion plate is from the American Diabetes Association, and it's a guide to what your plate should look like whenever you're fixing your meal. So on the left, you can see that there is a larger portion for vegetables. And on the right, that side is split in half. Half should be made up by your fruit and your whole grains. And then the bottom half should be made up of your protein. And then again, when looking at protein, you want to incorporate lean meats. So lean beef, fish, baked chicken, shrimp, nuts, almond butter as a substitute to peanut butter. Taking into consideration when you have diabetes, also have to take your diet, your hypertension and your high blood pressure and your cholesterol into consideration. So we want to make sure that you're not taking carbohydrates out of your diet and replacing it with only meat, because then that can throw your cholesterol off. So this is a nice, balanced, healthy plate idea of when you're fixing your plate, what your portion should look like. And with the diet, married to that should always be physical activity. So diet changes plus physical activity can lower the A1C by 1 to 2%. So if you are a newly diagnosed diabetic and you show up at the doctor for the first time and your A1C is 8%, you could just change your diet and incorporate physical activity and drop your A1C down to 6%. because changing your diet and increasing your exercise could decrease the A1C by 1 to 2%. So that alone could gain control. Now, if you are realistic with yourself and you say, okay, I can make some diet changes, but I can't do physical activity, you can't expect to get your A1C down, without medication. So marrying the two, you could possibly control without ever having to take medicine. The ADA recommends 150 minutes per week. And it's not, I often, when I ask patients, are you getting any physical activity? And they say, yes, I walk my dog. So I put here what some examples of physical activity, moderate intensity would be. So a brisk, uninterrupted walk, dancing, swimming, and bicycling. There's others. These are just some examples. And you can get that 150 minutes a week any way you'd like. You can do 30 minutes 5 times a week. You could do 50 minutes 3 times a week, 20 minutes most days of the week. However, you want to break it down and what fits into your schedule, as long as you try and get 150 minutes in per week. Now, if changing the diet and incorporating exercise alone did not work to control your sugar, or your sugar is too high to only, focus on those two things, and you have to look at medications, we usually try and start with oral medications just because it's a simple thing to incorporate into your daily activities. But if oral medications alone don't work, then we transition over to insulin. Listed here are just some of the common oral medications. If you have diabetes, you may recognize these. The last two here are some of the newer medications, empagliflozin and Jardiance. You may see a lot of commercials surrounding that right now, as well as sitagliptin, which is Januvia. Those run ads and commercials just about all day long. Some injectable medications, the ones on the left hand side of the screen are non-insulin. So just because it's an injection doesn't mean it's insulin. So the ones on the left hand side of the screen are non-insulin injectables. The last two being, again, the newer ones that you probably see a lot of commercials for, and they're gaining popularity because they're once a week injections. So semaglutide, which is Ozempic, and doluglutide, which is Trulicity, are both once a week. So if that is something that you feel like you could incorporate into your schedule or into your life, that may make your diabetes better controlled, it's something that you may want to discuss with your physician if they're not giving you that option. On the right hand side are the insulins. The first couple are very old and have been around for a very long time, the Novalogs, the Novolin 7030. And then the latter ones are some of the newer ones, Levemir and Tresiba. Tresiba being the newest insulin, and that one is a very long-acting insulin. It could last anywhere from 24 to 36 hours. So you could get away with only taking that one once a day, as opposed to the others that require multiple injections a day. I included this slide because I feel like every time we mention insulin, there comes a fear and anxiety surrounding it, which causes us to push insulin off until sometimes it's too late. There's the myth that if we have to introduce insulin into the regimen, then that means it's the end of the life, or you're facing complications. And that's not true at all. Research has shown us that if we introduce insulin much earlier and we're much more aggressive with it, then we can prevent a lot of complications from occurring. So we have to try to bust those myths and educate each other that insulin doesn't mean that it's the end of life and that you are going to succumb to diabetes. We're actually introducing insulin much earlier to prevent any of those complications from occurring. So with a lot of research, we've shown that insulin is the most effective way to control the blood sugar. As I was describing and giving the definition of diabetes, you heard me say that the problem is either insulin resistance or we're not producing enough insulin. So the best way to control it is to give yourself the insulin. And it's also the fastest way to gain control. And it preserves the cells within the pancreas that produces insulin. So they have a longer lifespan because they can rest and they don't burn out as fast if we give insulin much earlier in the disease state process. And then, like I've mentioned, it prevents the diabetes related complications. Hypoglycemia is a common effect that occurs once you start taking medications. It can be individualized, but the general definition is less than 70. So having a blood sugar less than 70, you may experience symptoms. I always describe hypoglycemia as the Snickers commercial. Some people get really hangry or angry because they're extremely hungry. They may have cold sweats in an air conditioned room. They may be very agitated, have a slight tremor or shake. Those are all signs of hypoglycemia or a low blood sugar. And the best way to treat that is to take glucose tablets, 3 to 4 of those, 4 to 6 ounces of orange juice or regular soda. Make sure it's regular soda and not diet soda, or 8 to 10 hard candies. Hard candies like peppermints, lifesavers are preferred. Something like chocolate or a piece of cake or a piece of pie that has too much fat and it delays the absorption of the sugar. So you won't be able to raise the blood sugar fast enough. So you need hard candies to do the job quickly. And then if it's an emergency situation and medics are called, they'll use what we call a glucagon injection. In any case, you want to eat a light meal when possible and then recheck the blood sugar in 15 minutes to make sure it's coming up. And then finally, we have the complications of diabetes. This is ultimately what we're trying to avoid. Diabetes, yes, means you have a high blood sugar, but then so what? What does that mean? How does that affect you? So if your sugar is too high for too long, it will cause eventually complications. And the problem with diabetes is you can't always feel what it's doing until it's too late. So, very similar to high blood pressure, which could be a silent killer, diabetes is also often silent until it's too late. So, the complications of diabetes are separated into macrovascular, which means the larger organs, and then microvascular, which are the smaller organs. So, uncontrolled diabetes for a long period of time could cause someone to have a heart attack, which is cardiovascular disease, or a stroke, cerebral vascular disease. And then on the microvascular side, it could cause kidney disease, often a reason why individuals end up on dialysis. It causes vision loss, which is also known as retinopathy, peripheral neuropathy, which is usually one of the earlier complications that people notice. That's when you get numbness and tingling in your feet and your fingers. So that is the earliest sign that you are already experiencing a complication of diabetes, and then as well as erectile dysfunction. The clinical impact of these complications, diabetics are at a 2 to 4 fold increase for cardiovascular mortality. So that means death due to heart disease. So diabetics are at a 2 to 4 fold increase of death due to heart disease. It's the leading cause of new cases of end stage renal disease. So that's kidney disease or requiring dialysis. It's the leading cause of new cases of blindness in working age adults, as well as the leading cause to non traumatic lower extremity amputations. Amputations is a concern, especially when it's something that is so, all of these are preventable if you can control your diabetes. And when it comes to the amputations, that's the one that you usually don't have a lot of signs that there's a problem. If you're having vision trouble, you can go to the eye doctor and determine if you're experiencing vision loss related to diabetes. And your doctor can do blood tests to determine if you're having kidney disease related to the diabetes. But with the amputations, what happens there is because there's so much blood sugar or so much sugar in the bloodstream, the blood isn't circulating to your extremities. So usually your hands and your feet don't get quality oxygenated blood. And if the blood isn't flowing to those areas and you get an infection, that area can't heal. And by the time people seek care for that, it's oftentimes too late. And if that infection or that area becomes gangrene, they have to cut it. So I've had patients I had a specific incident where a patient stepped on a nail. He was a carpenter, went the entire day, had no clue he had stepped on a nail because there was no blood flow to his feet. He couldn't feel his feet. Stepped on a nail, went the whole day, got home. His wife noticed when he took off his shoes that his socks were bloody. And by the time they got to the hospital, tetanus had already set in and his foot had to be amputated. So I highly encourage anybody that has diabetes to make sure they're looking at their feet. If you can't see your feet yourself, use a mirror or have someone in the home check your feet for you. Make sure you wear white socks so you can see if you're bleeding, because if you have on black socks, you may not see that you're bleeding. And then seek the care of a podiatrist if you can't, care for your feet yourself and trim your toenails and all of those things. So make sure you're taking care of your feet as well. When it comes to the disparities as far as the complications are concerned in African Americans, diabetic retinopathy, so the vision loss, is 46% more prevalent in African Americans, and we are 2.6 times more likely to experience diabetes related end-stage kidney disease. So we're the highest population that's on dialysis related to diabetes as well. Again, I thank you for the invitation to speak to you all. I hope you were able to learn something, and if you yourself don't have diabetes, that you can take some of the information shared here today to your loved ones and to your community so we can improve the quality of care and we start to break some of the barriers that frighten us when it comes to diabetes so that we can get the care that we need. And at this time, I'll open it up to questions.
Okay, Sister Teresa, did we get any questions? If not, I have one or two.
Okay, sure.
No, Pastor, we didn't get any questions yet.
Okay. Thank you so much for this presentation. It was some interesting things in there, and the more I hear about diabetes, I go to my doctor's office, she's always playing different tapes and stuff, and more I hear about it, the more it begins to be interesting. Again, what we need to think about as African Americans is these dialysis machines. There's a lady I know in Fort Lauderdale. I've been knowing her for about 30 years. She works as a dialysis. 30 years ago, she was working. They had 5 centers in South Florida, 2 in Fort Lauderdale, I think 1 in Delray, a couple in West Palm Beach. Now they got 60 or 70 in that county alone. And this is something that we can prevent. Again, our bodies are the temple of God, and God will hold us accountable. We can't be lackadaisical about it. We can't be lazy about it. These things are killing us. There was a former pastor I knew in Fort Pierce. I was a young kid then, and I used to hear him say something. I didn't really understand what he said. He said, "We dig our grave with a spoon." And I didn't understand what he was talking about, but I understand that we dig our grave with a spoon, and it's no cause for it. I know we've been like of a lot of things, but there's no excuses. We just got to do better, especially as Christians, to lead the way. God has given us this information. We need to believe in the science. The stats are there, they're repeatable, and they're getting worse instead of better. So with that, I want to ask a few questions because some of them hit me pretty hard here. Now, you were talking about this this stomach fat. Now tell me about that. Was that internal, external? Was that caused by this term cortisol? Talk to me about that.
Very
so we
good.
can hear about that.
That's a great question. So a easy way to determine if you are experiencing abdominal obesity or if you're at risk, and we call it metabolic syndrome, is a waist circumference over 40 inches for men, over 35 inches for women. So you know your pant size and you know your belt size. So if it's over 40 inches for men and over 35 inches for women, then you are on the other side of that.
Okay. All right, I'm gonna ask you one more question. Then we got some more questions. I got another. So, having said that, with this midriff and trying to get rid of that, tell me about my BMI. What is that doing for me in that area? Is my BMI doing anything, that number for me? I know what mine should be.
Right. So BMI is used to determine if you're overweight or if you're obese. However, the BMI can be falsely elevated if you're a very muscular person. So we don't
Okay.
try to go solely based off of BMI. But yes, if your BMI is elevated, anything that puts you in an overweight or obese category increases the risk for diabetes. And as you lose weight, your risk for that decreases. And or if you've already been diagnosed with diabetes, as you lose weight, then the A1C or the control will get better.
Okay, thank you for answering that. So now I know why my BMI is over. I'm muscular.
There it is. That's it.
Sister Teresa got some questions for us.
Sister Norwood,
Yes.
one of the questions says, can diabetes be reversed?
Okay, so I don't like to use the words reversed and I don't like to use the words cured. It can be very well controlled and it can be managed without medications. That does not mean that you have completely gotten rid of it, because if you go back to the old habits and start eating macaroni and cheese and fried chicken and potato salad, it's going to show its ugly head again. So it can be controlled and managed as long as you're following the diet and lifestyle changes.
Thank you. The next question is, what if the blood pressure is consistently high, but the cholesterol level is okay, and the blood pressure medication has been changed several times? Is this an indication of diabetes?
No, not necessarily. So when I was pointing out that the three of them normally travel together, so meaning if you have diabetes, then there's also a very good chance that you have high blood pressure, hypertension, and uncontrolled cholesterol. Now, you could solely just have one of the three or two of the three, but they generally roll together. But if you have been diagnosed with hypertension and high cholesterol, and your blood pressure is uncontrolled and remains uncontrolled with multiple medication changes, you may, first of all, you can email me, but I can look at your specific regimen. There are medications that African Americans for high blood pressure respond better to than other ethnicities. And that is often not taken into consideration. So instead, some doctors want to just pile on medication, and you're on 2 to 3 high blood pressure pills, where if they just give you the one that African Americans respond best to, you may not require the other ones. So it's, if you have a specific question about your regimen, please feel free to email me.
Okay, thank you for that. The next question is, what are some of the issues when being diagnosed as pre-diabetic?
So being diagnosed with prediabetes means that you have not met the blood levels, the criteria to have an actual diagnosis of diabetes yet, but you're at risk for diabetes. So there's 2 things that you could do in that case. Diet and physical activity is the best thing to do. And you could prevent and delay the onset of diabetes completely if you catch it in the pre-diabetic phase. The other thing that they do is put you on a trial regimen with metformin. And metformin has been shown to stop the progression to actual diabetes if you catch it in the pre-diabetes phase.
Okay. So this other question, Sister Norwood, I think you answered already, but I want to ask it anyway to keep fair.
Okay.
Is childhood diabetes reversible? You answered it, or will it carry on throughout adulthood?
Okay, so childhood diabetes is something completely different than what we talked about tonight.
Okay.
So I only talked about type 2 diabetes, which is usually adult onset diabetes. And I say usually only because now, unfortunately, with the diets of our children, they are also getting type 2 diabetes much earlier because we have a generation now that has a high rate of obesity amongst kids. But generally, diabetes type 2 is diagnosed at 40 years of age or older. Now, childhood diabetes is type 1 diabetes. And type 1 diabetes means that there is a genetic condition that you have zero insulin production. Your pancreas does not produce any insulin. So you require insulin injections or insulin via a pump, from the beginning of your diagnosis as a child. That is not reversible nor curable unless you have a pancreatic transplant.
Okay, thank you. The next question says, what medicine African Americans respond better to for hypertension? You knew that was coming, right?
I should have known that was coming. And again, as Pastor said, I cannot give any individual therapy recommendations without knowing your history. So very, very, very casually speaking, African Americans respond best to diuretics and to calcium channel blockers. So calcium channel blockers would be amlodipine or anything that ends in pine, P-I-N-E, verapamil, diltiazem, and then the diuretics, most people know hydrochlorothiazide. Chlorthalidone is a very strong, powerful diuretic that African Americans respond well to, but you have to have very good kidney function to be able to take diuretics.
Okay, so the next question I have from our website this time is intermittent fasting recommended for diabetic.
So, again, my disclosure is I'm not a nutritionist or a dietitian, but the problem with intermittent fasting, if you're on diabetes medication, is you could be at a high risk to develop hypoglycemia. So those periods when you're not eating, because diabetics, due to the medication that they take, have to eat 3 meals and snacks in between to avoid hypoglycemia. So if you're fasting and you're taking your medication, then the blood sugar will drop and you could experience hypoglycemia. And I didn't get to mention this, but one of the dangers of hypoglycemia, not only could you lose consciousness, but it also could cause damage to the heart. So we try to avoid hypoglycemia.
Well, thank you for that. I don't have any more questions at this time, but I really appreciate you.
Thank you.
Okay. Well, I got a few more while the other ones are coming in.
Sure.
Yeah, well, one of these things is so big, and you were talking about those 3. I don't even know whether I can pronounce it.
That's
sounds
okay.
scary to me, but it said comorbidities.
Yes.
So talk to me what that great big word means.
So comorbidities is just a fancy way to say your other medical conditions. So if you have diabetes plus hypertension, they're comorbid. So there's 2 medical conditions, chronic medical conditions there. So again, you want to treat the whole person. So when somebody comes in to see me for diabetes, I'm not just going to treat your blood sugar and send you on your way. I'm also going to make sure your cholesterol and your blood pressure are under control. And that is the best way to prevent the stroke and the heart attack that comes along with diabetes complications.
Oh, great, great. Now, is there any new discoveries that I can test my sugar without getting stuck?
So there is the Dexcom, which is on the market now, and a lot of people ask about. You still have to stick yourself, just not as often, but it's like a little patch that goes, or it's a little prick that goes into a sensor, that's the word, that goes into the arm, and you just wave the machine over the arm and it'll register your blood sugar. So the sensor is good for 24 hours, so you have to change the sensor every day.
Oh,
so instead of
stuck.
Yes, you're still getting stuck, but instead of pricking your finger 3 and 4 times a day, you only have to put the sensor in once a day.
Okay.
And then for those who are on insulin, there is a continuous glucose monitor, which is inserted into the stomach area, and it stays there, and that's constantly monitoring your blood sugar.
Okay, all right. Waiting on a few more questions, so I'm gonna ask another one while Teresa is receiving them. this A1C business.
Yes.
So how am my A1C affected when I eat at 10:30 p.m. at night?
So the A1C is hard to say how it would be affected because remember, that's the 3-month average of the blood sugar.
Gotcha.
So the A1C, when you get that blood test done, it's actually monitoring the amount of sugar on a red blood cell. And we turn red blood cells over every 90 days. So your A1C is going to tell me everything you did from May till now or June until now. So if you had macaroni and cheese 2 months ago, I'm going to see it in your A1C. Now, to answer your 10:30 p.m. question, if you eat at 10:30 p.m. at night, when you wake up in the morning, chances are your sugar is going to be high when you check it on your finger stick. And that's because our metabolism slows down after dawn. So we're not breaking down anything that we eat late at night. We're storing it right there in that stomach, which further leads to that abdominal obesity.
Wow.
Okay, Sister Norwood.
Yes.
One of the questions it says, what about cherries? I heard you say berries are good.
So cherries are okay. And if you have to make a choice between a piece of cake and cherries, I would prefer you to take the cherries. The problem is how many cherries. So once you start to consume too much of anything, because they do have natural sugars in them, then it could raise your sugar. So you just have to keep the portions. Again, a general rule is it should be able to fit into the palm of your hand.
Oh, okay.
Wow. All right. Well, my final question is, if there's no other, what is the one piece of advice do you have for the average African American in regards to diabetes?
Good question. The best advice I could give is that you need to be an active participant in the care of your diabetes or in the care of any medical condition. Again, like I said, doctors make a lot of assumptions about African Americans that we may not be able to come back, or we won't come back. They assume we won't come back from monitoring. They assume we can't afford certain things. So if you're not getting the results that you are expecting to get or you would like to get, ask them, okay, are there newer medications that we could take a look at or give a try to? Are you monitoring my A1C? What was my A1C? What was my A1C before that? Am I trending up or am I trending down? So the more pressure you put on them, they recognize, oh, they care about living longer. They care about preventing the complications. So let me make sure as a provider that I give them everything I have in me because they're vested into their healthcare. So my advice would be to be an active participant in your care.
Okay, it's my turn again. What is the correlation between diabetes and COVID-19?
So as everybody on here knows, we are all still learning about COVID. It's all new for healthcare providers, something that we're learning daily as we go. So the reason there's no relation, meaning like if you have diabetes, you're at greater risk for getting COVID-19, but you're at greater risk for having more of the severe complications. And that is because your body is already in a compromised state. When you have high blood sugar, remember I said the blood stream is full of sugar instead of the oxygenated blood. So you're not getting free flowing, oxygenated, healthy blood, circulating throughout your body. If you think about, filling a cup that has water in it with sugar, that's what an uncontrolled diabetic's bloodstream looks like, okay? So it would be hard to fight off an infection when your bloodstream looks like that.
Okay, thank you for that. So the next question says, does sleeping after meals increase your risk for diabetes?
Yes.
So that was for you.
So you never ever want to get the itis. You don't want to go to sleep after you eat. I recommend saving chores or household type things for after dinner. So it forces you to get up and move around. If you want to take your walk after dinner, so it again forces you to move, and that also helps the metabolism and improve the blood sugar, as well as improve the sensitivity to the body to the insulin.
Okay, thank you for that. The next question says, is it okay for your primary doctor, rather than your endocrinologist, to treat you for diabetes?
Yes, so that's a good question and something that I meant to mention. Primary care providers are very capable of managing diabetes, but in the state that we're in healthcare, primary care providers don't often have the time to give to you for your diabetes management. You're probably in and out of your primary care's office in 10 to 15 minutes. You don't get very much face time with your doctor anymore. So if you don't feel like you're getting the quality of care that you need from your primary care provider, then it may be time to seek out an endocrinologist who can give you that dedicated time for the diabetes management. However, if you're happy with your primary care and they're doing a good job at managing you and you're hitting your treatment goals, by all means, they're qualified.
Okay, thank you. The next question says, would you discuss the use of supple? Do they mean supplement?
I don't know.
Okay, so maybe they'll come back and give me that. Okay, she meant discuss the use of a supplement such as cinnamon.
Oh, okay, good. That's a good question. So cinnamon is one, so there's a lot of things out there, especially on the internet, where you can control diabetes naturally. But cinnamon is actually one of the few that has been researched. And it does reduce the blood sugar, not enough to control it without other actions, but it does help. So if you sprinkle cinnamon on your food, or if you take cinnamon capsules, you could see a decrease in your blood sugar.
Okay, thank you for that. It says, the next question says, what are the best foods to eat between 8 and 11 p.m. without gaining weight?
Nothing. If you have to eat something late at night, again, you have to take in all of the things that are going on with your body, but you would want to eat something that's a protein instead of a carbohydrate. So like a slice of turkey or a couple slices of turkey and some cheese, some almond butter, something like that would be a better alternative. Nuts, than chips. You don't want to do chips, popcorn, any of that stuff. No bread.
Okay, the next question says, are you in West Palm Beach?
I live in Green Acres and I work in Delray Beach.
Okay, so they're asking for your email address. So at the bottom, I'm going to put up your email address for them.
Sure.
Okay, so the other question I have is, can I include a black seed pill with my diabetes medicine?
A black seed?
It says black seed pill.
I don't know. If that individual wants to email me, I would have to research what a black seed pill is. I'm not familiar with that.
Okay. Next question says, is there a gender disparity when it comes to diabetes?
Yes, there is. Males are more likely to develop diabetes unless a woman or any female that experienced gestational diabetes, so they had diabetes while they were pregnant, then they become the higher risk. But in general, men are more likely.
That answer your question, Pastor?
Oh yeah, I already know that we're prone for everything. God loves us, and so we're prone for everything. Do want to thank you so much, Doctor, for being on. A job well done. I think it was very informative. Again, if you need more information, reach out to her. She has an email there, and I think a phone number, but probably preferable email. It'll be a little more able to manage. She has two budding little girls that need some attention, and so email, she can get to it at any time she would so desire. And I do want to say, hopefully next week we will have another one, and we will have a dietitian for all of those people who want to know a little bit more about the food in concern with diabetic. I do know now that at the end of the 90 days, which should be coming pretty soon, I can eat a piece of red velvet cake and it goes on the next A1C. Thank you so much for being, for being with us. If there's no other questions, I would like to close in prayer. And thank you so much. We bid you Godspeed.
Thank you for having me.
I do have another question, Pastor.
Oh, okay. Come on.
I do.
Come on.
It says, what about CMOS for diabetes?
So again, like I said, there's a lot of things out there that proclaim to help and cure diabetes. There's no harm in CMOS. It won't hurt it, but we have never proven that it will help.
Can you go ahead and give me your email again so they can have it?
Sure. It's R Norwood, which is NORWOOD 21@gmail.com. So rnorwood21@gmail.com.
Thank you.
Okay, let's close with prayer. Father, we thank you now for this time, this opportunity. Thank you for equipping our dear sister with the information and the zeal to make this world a better place by honoring our bodies in a Christ-like way. I pray your blessing upon her and her family. I pray your blessing on everyone who have heard tonight. Help us to be responsible. Help us to be the people that will follow through on the statistics, that we might not only have a quantity of life, but a quality that also go with it. So Father, we pray as it spread, that it'll do what it has been designed. Keep us in your care as our prayer. In Jesus' name we pray. Amen and good night.
Thank you.
Okay, you